Hi and welcome back to my channel. If you're new here, my name is Jenny. I am a late diagnosed autistic adult. I was diagnosed in 2021 at the age of 48. Recently, I've had some questions about if I have alexithymia. The way I've been feeling lately has kind of prompted me to understand or figure out what it is. I wrote a journal entry yesterday I want to share with you, just being open and honest about how I'm feeling, if you can relate to this. So I feel like I'm having a lot of trouble feeling emotions lately. I can't remember the last time I was able to cry. Sometimes I don't understand why I don't think of others more. I have compassion for people when I remember them. It's truly out of sight, out of mind for me sometimes. My demeanor's pretty much the same the majority of the time. So maybe you can relate to feeling the same pretty much all the time without a variation of emotions or feelings. And so that's why we're going to be talking about alexithymia today. Okay, so here is what alexithymia is. It says there's a number of factors that might contribute to high levels of anxiety in those with ASD. One of those factors seem to be the difficulty that many individuals with ASD experience in identifying and describing their own emotions, a phenomenon known as alexithymia. When I read that, I went and took an online test that I found just to see how I would score on it. So I found this test on the website called embraceautism.com, and you can go and check it out and take it for yourself and see what you score. An example of one of the questions that was on here was, I prefer doing physical activities with friends rather than discussing each other's emotional experiences. You can strongly agree, neutral, disagree, or strongly disagree. All the questions have those options. For this particular one, I put strongly agree because I would rather be doing activities than talking about emotional experiences that I'm not good at answering anyway. That's been my go-to my entire life. If I'm around people, do things. If we're doing things, there's not much time to talk about things that I'm uncomfortable talking about. So that my whole life, even as a kid, when I didn't know of my diagnosis, it was my coping strategy just to do activities with people. And it kept me away from those deep conversations, I believe. But in doing so, you fail to never really know someone on a deeper level. And that's been my entire life with friendships, I think. It's why I failed at so many friendships. It's why it's so hard for those of us who are autistic to truly make friends. And as I'm answering this question right now and talking about it, I notice I'm stimming with my toes on the chair. So what did I score on this test? I scored a total of 129. That puts me in the range of alexithymia present. If you score between 113 and 185, it predicts you have alexithymia. When I go in for my next counseling appointment next week, I will definitely talk to my counselor about this. Last time I was in her office, I broke into tears because I wasn't able to express to her what I was feeling, and it all came out in a jumbled up mess, and I just wasn't able to communicate what I wanted to tell her, and it was so frustrating. I was just crying about it. Maybe you can relate to that. Alexithymia is also known as emotional blindness. It's characterized by significant challenges in recognizing, expressing, and describing one's own emotions. There are people with other conditions besides autism that can have alexithymia. We struggle to put our emotions into words. As far as people with autism, it says 50 to 85% can suffer with alexithymia. That really doesn't surprise me at all. The myth is there's a misconception that individuals with ASD lack emotion. The reality is that research shows that people with ASD do experience emotions, but express them differently. So this is something I'm going to continue to research and figure out for myself and understand, and try not to be hard on myself. what's the point in beating myself up over it if it's something that I can't help? And I just want to update you, if you saw my video about going to the doctor and how hard it is for people with ASD to go to the doctor in general, I found this on Amazon, and it was like, I want to say $13, doctor visit logbook, and I just really love this. So maybe you struggle when you go to the doctor remembering what to say, remembering what test you've already had. They'll ask you when your last mammogram was, your last colonoscopy, all those questions. You know, it's already overwhelming to be there. So when you have something like this, it is much more easier, and you can put yourself more at ease as possible when you have the answers that you need, what medications you're allergic to, what you've been on already. So I would highly recommend one of these. Anything that can help, right? You can track your medical visits and put what the doctor talked about. How helpful is that? I mean, can we really remember a year or two ago what our doctor visits consisted of, what was prescribed? We can't remember all of that, but we don't have to if we just write it down. So I just wanted to recommend that if you're looking for an option. So thanks for watching this video, and go down there and comment what made sense to you, what were you able to relate to in this video, and do you feel like you have alexithymia as well? We'll see you in the next video. Bye.